It's my great pleasure to present at the McKeag Institute Wood Forum. This morning, I'm going to focus on targets for the prevention of injuries in youth sport. In Calgary, as in many places around the world, we see high rates of participation and injury in youth sport. This leads to a significant public health burden. In Alberta, we expect 1 in every 3 youth ages 11 to 18 to seek medical attention for a sport-related injury each year. Lower extremity injuries account for 60% of these injuries, and of those, 60% are ankle and knee joint injuries. The greatest proportion of these injuries occur in sports such as basketball, ice hockey, soccer, skiing, and snowboarding, where we see high rates of participation as well as high injury rates. The consequences of injury in youth sport can also be significant, and these may include reduced levels of physical activity, overweight and obesity, psychosocial consequences, post-traumatic osteoarthritis, and the economic burden associated with injuries in youth sport. Sport-related injuries in youth are predictable, and therefore they are preventable. When we talk about prevention, it's across the continuum from primary prevention, where we're targeting youth who are healthy and participating in sport to prevent injuries from happening in the first place. Secondary prevention, with a focus on the prevention of injury recurrence, perhaps in those that have had a previous history of injury. And tertiary prevention, whereas clinicians, we work in rehabilitation to prevent consequences of injuries in youth sport. I challenge you to think upstream towards primary prevention, where we can have the greatest public health impact in reducing injuries and their consequences in youth sport. When we do research in sport injury prevention, we rely on surveillance to inform the extent of the injury burden in specific youth populations, for example. And as well, we can evaluate risk factors for injury in youth sport, which then lead to the development and evaluation of prevention strategies. Validated injury surveillance, in this case, led by the Sport Injury Prevention Research Centre at the University of Calgary, relies on strong partnerships with community clinical partners, as well as sport and school partners, to ensure the efficiency of the injury surveillance system in evaluating prevention strategies in youth sport. The targets for prevention are across rule changes, equipment, and training strategies. And I'm going to share with you some of our research that has informed best practice and policy in the prevention of injuries in youth sport. This research relies heavily on strong partnerships with sport and school partners. Our injury surveillance system, we call SHRED injuries, or surveillance in high school and community sport to reduce injuries and their consequences. As with any research, we require consent to participate, collection of specific exposure data or participation hours and practices and games, for example. And then we collect injury data out in the field and at the ice hockey rink, for example. It relies on study therapists as well as physicians to assess injuries following their identification in the field. Our injury surveillance data feeds back to clinicians to make the best decisions for return to sport, return to school, as well to our stakeholders, so that we can have evidence informing best practice and policy in the prevention of injuries in youth sport across schools and community. To share with you an evaluation of policy in youth ice hockey, we've been doing research for over 15 years, and evidence informed a policy change to disallow body checking in 11 and 12-year-old games across Canada. When we had the opportunity to evaluate this policy change, we found a significant reduction, 50% reduction in all injuries and a 64% reduction in concussion alone following this policy change in 11 and 12-year-old ice hockey leagues. If we translate that to the national impact, we see an estimated reduction of over 6,000 injuries in Canada and 11 and 12-year-old players alone following this policy change in 2013. This research informed further policy change regionally and provincially in older age groups. And in one of our studies, we evaluated the reduction of injuries and concussions in 15 to 17-year-old players following regional and provincial policy change, disallowing body checking in non-elite levels of play in 15 to 17-year-old leagues. Non-elite levels includes 60 to 70% of players in this age group. And what we found was a 65% reduction in all injuries and a 51% reduction in concussion alone. This translated to an impact and an estimated reduction of over 7,000 injuries in 15 to 17-year-old players across the country if all provinces had policy disallowing body checking in non-elite levels of play. Moving on to training strategies. Neuromuscular training is a well-known strategy to reduce the burden of injuries in youth team sports. Through a 10 to 15-minute warm-up, including aerobic exercises, strength training, agility and technical components such as jumping and landing skills, as well as balance training, we see a significant reduction in injuries across multiple sports. Neuromuscular training evolved from rehabilitation strategies, for example, following anterior cruciate ligament injuries in youth. They became more well known in sport performance, in team sports, and then further became part of a standard of practice warm-up, targeting the prevention of injuries and improvement of performance in athletes. And then more recently in physical education classes, targeting a more global reduction in injury rates in youth. Sharing with you a randomized controlled trial where we evaluated neuromuscular training in indoor soccer in Alberta, where we see a significant reduction in all injuries of 38% and an impact in injuries across numerous injury types, such as ankle and knee injuries, as well as concussion. When we teamed up with our very own Dr. Deborah Marshall, the McCaig Institute, a health economist, we're able to do an economic evaluation alongside our evaluation of prevention strategies in youth sport. And in the context of neuromuscular training in youth soccer, we see a significant reduction of injuries, as well as a reduction in costs associated with those injuries in this cost-effectiveness plane. If we evaluate and interpret the reduction in Alberta, if neuromuscular training was part of standard of practice across all leagues in youth soccer, we would save over 5,000 injuries and over $4 million in healthcare costs in Alberta in one season alone with neuromuscular training in youth soccer. Further to that, we did a large randomized controlled trial over 3 years in junior high schools, now targeting 11 to 15-year-olds. These students are participating in physical education, and neuromuscular training was a warm-up strategy implemented in their physical education program. What we found with implementation of neuromuscular training in physical education was a significant reduction of all injuries, lower extremity injuries, and medically treated injuries. However, this was only in female students. When we looked at the boys, we saw no reduction in injury rates across these definitions. We think this may be related to exercise fidelity in boys that are 11 to 15 years old in a non-sport specific setting. So that relates to the quality of movement in completing the exercises in the neuromuscular training warm-up. This was not seen, this differential effect, in sport-specific settings across numerous randomized controlled trials in team sports, where we saw an effectiveness across boys and girls. Further to this, we've translated to scaling up workshops for teachers, coaches, and clinicians across Alberta. A shout out to Carla Vandenberg, who is our knowledge broker that has led this work with the support of the Alberta Bone and Joint Health Strategic Clinical Network. We've delivered over 128 workshops to more than 2,200 participants in Alberta. We've developed resources. They're available on our website and inclusive of videos that are available across multiple sport-specific and physical education contexts. Shred Concussions is a pan-Canadian program of research that's funded through the NFL Play Smart, Play Safe program. While it's focused on concussions, we use injury surveillance to be able to identify and evaluate prevention strategies for all injuries in youth sport. This is supported also through the Canadian Institutes of Health Research and other funding bodies. We are targeting 6,000 high school sport participants, participating in more than 12 high-risk injury sports across 5 provinces. We will have the opportunity to evaluate prevention strategies across rules, equipment, and training targets. I'm really excited to tell you about the Shredmobile. If you haven't seen it yet, this is our mobile unit supported through a Canada Foundation for Innovation infrastructure grant. We are scaling up our injury prevention research program, as well as our knowledge translation program across Alberta and beyond. We are partnering with rural communities, as well as Indigenous communities, to support a greater public health impact in the prevention of injuries and their consequences in youth sport. To shred injuries, we need to move upstream towards primary and secondary prevention to have the greatest public health impact. We need to continue to scale up our validated injury surveillance to evaluate injury prevention strategies across rules, equipment, and training. We wish to inform best practice and policy in the prevention of injuries in youth sport with a lofty goal of reducing injuries in youth sport in Alberta 25% by 2025. A shout out to the incredible team at the Sport Injury Prevention Research Centre and the Faculty of Kinesiology at the University of Calgary. This team has supported much of the work that I have shared with you today and beyond. I want to thank as well our community partners across sport, schools, and clinical partners that support the work to inform best practice and policy in the prevention of injuries in youth sport. Of course, I need to thank my kids who led me to make injury prevention in youth sport a priority. Thank you so much for your time this morning, and I really look forward to the panel discussion to follow.